Hello, my name is Mary Jacobson. I'll be the moderator of this session. I'm honored to introduce Cara Liebert. She's a current Stanford medical student who'll be graduating in June of this year, and she'll be going into surgery for her residency. She's going to talk about environmental toxins and reproductive health.
All right, thank you for coming. It's a pleasure to be here. Apologize for the technical difficulties. It's a little bit of an older version of the slides, but we'll go with it. So just to give an overview of what I'll talk about today, first I'll give a little bit of an introduction about what environmental toxins are. And then this is such a broad field that it's really difficult to choose what to talk about in a short amount of time. But I'll focus most of the time on two environmental toxins that are, I think, are most relevant, which are phthalates and Bisphenol A, which are both found in plastics. If we have time, I'll briefly talk about other environmental toxins. Spend a little bit talking about how they affect male infertility as well, and then what we can do about reducing our exposure. So first of all, these are chemicals that are found in the environment that have a negative impact on our health and can affect fetal development. And there are greater than 85,000 chemicals that are in production, and each year there are more and more. So 1,000 to 2,000 are produced new each year. And while we know that some of them are dangerous, unfortunately very few of the chemicals out there have actually been tested to be safe. So the norm is really for chemicals to come into production and be used before they're fully tested to see if they're a reproductive toxin. So often it's only after we've been exposed to them for many years and the research is compiled that we find out that they can be dangerous to our health. So there are many routes of exposure to these toxins. Some of them we get exposed to through our skin. So phthalates and Bisphenol A we can absorb through our skin. A lot of them are through oral intake. So Bisphenol A and phthalates are in plastics and food containers. We can eat them in our food, or they can be in contaminated water. PCBs we can take through fish intake, as well as heavy metals through fish. Some of them we inhale, either in dust or as vapors. And then for developing fetuses, transplacental exposure of almost all of these chemicals, and then in breast milk, many of them can enter maternal breast milk. So there are potential effects of environmental toxins on reproductive health that affect the entire lifespan and also cross genders. So some of these effects are and reproductive endocrine disorders such as polycystic ovarian syndrome. They can sometimes be linked to reproductive cancers such as breast and prostate cancer. They can affect conception by causing infertility or increasing the rate of miscarriage. And then as further down during fetal development, they can cause birth defects. They can interfere with genital development of particularly of males. They can have effect on brain development and cause some neurobehavioral effects that can last into childhood. And then even learning more about now is that it also can affect the fertility of future generations. That an exposure that a woman has during her life and her pregnancy could affect the fertility of her grandchildren. So just a brief word that there's been studies showing that rates of infertility have increased recently. And in 2005, the CDC showed that about 12% of people reported infertility, and that had increased about 20% since 1995. And so the question is, are environmental toxins responsible for this? And the answer is complex, that obviously other factors are playing a role, and we know that women are having children later in life and that rates of infertility increase as a woman ages. But it's also possible that one major contributing factor may be environmental toxins. So it's been just a brief moment talking about something called endocrine disruptor, because many of the toxins that I'll talk about today are endocrine disruptors. So this is any chemical outside the body that can interfere with the production, the release, the metabolism of a hormone that's in the body. And as hormones in the body act often at very low doses to cause physiologic effects, often these chemicals only have to be in very low doses to cause an effect. So it can be, a lot of times companies will try to reassure us that the amount of chemicals or toxins in products is so low, but sometimes it can be 1 part per billion that is all that's needed to have a negative effect. Now, the endocrine disruptors that we'll talk about today fall into two major categories. So they're estrogenic here, which means that they mimic estrogen in the body, or they're anti-androgenic, which means that they can block testosterone. And so bisphenol A, one of the chemicals we'll talk about today, falls in the estrogenic category, and then phthalates, which we'll spend a lot of time on also, is anti-androgenic. So first I'll talk a little bit about phthalates, and a lot of the research that I'll be talking about comes from from Shanna Swan, who is a PhD out of the University of Rochester, and she's one of the collaborators that I've worked with on another research project. But this is mainly her work. So just to give an introduction to what these are. So this is a chemical name, diethylhexyl phthalate. And this is an endocrine disruptor that blocks testosterone. And unfortunately, this is something that applies to everybody. Greater than 80% of people have this detectable in their body in blood or urine samples. It's produced in very high quantity in the United States each year. It's in products that we encounter every single day, and it's what makes plastics very soft and flexible. So IV tubing and IV bags are a very common source of phthalates. And then extremes of temperature, scratches, damages, or containing products that are lipid or full of fat increases the rate that it leaches out of the product and into food or liquid. Now, just to talk a little bit about how you get this exposure and where it's found. So I talked about the IV tubing. So actually, I believe that Packard Hospital has made a commitment to use all phthalate-free IV bags and IV tubing in the Children's Hospital. But this is during dialysis or during prolonged hospital stays can be a significant exposure. A lot of toys, so soft, flexible plastic toys contain phthalates. Vinyl flooring and any vinyl products like shower curtains or bath mats. And then, in baby toys, a lot of teething toys, unless they're labeled as phthalate-free, they often contain phthalate, which can be, for a child, a very high level of exposure if they're chewing on it. Saran wrap, and then a lot of cosmetics contain phthalates as well. And the difficulty is that sometimes this isn't labeled. Products have started to label some products as phthalate-free, but they don't have to list phthalate as an ingredient. So sometimes it can be very difficult to find out whether a product contains this or not. So how do these chemicals affect reproductive health? They're linked to infertility in both men and women. And the main thing I'll talk about today is how they interfere with fetal development. Specifically, I'll talk about their effect on male genital development, and this is really where a lot of research has been done in this area. So just as an introduction, in order to have normal male genital development during pregnancy, there is a peak of testosterone that needs to be present in a short window for normal development. And as we talked about, a phthalate blocks androgen, so it blocks testosterone, and it can decrease this peak during that critical window. And so I'll talk about this in the next slide, this phthalate syndrome, of what happens if you're exposed to phthalate during pregnancy and interfere with the testosterone levels. So this is, a lot of initial research was done in rodents, and if you give rodents exposure to phthalates, then after birth, and you measure these young mice, you notice that something called the anogenital distance, that's shortened, and that you can notice malformations of various reproductive organs in the male baby mice. You can notice birth defects, something called hypospadias, where the urethra is the incorrect location on the penis. And then you can have difficulty with testicle descent. And I think the question was, is this observed in humans? So Shanna Swan, who I already spoke about, was interested in looking at whether this can be replicated in humans. And so this measurement of anogenital distance that you can observe in mice, you also can measure in humans. And it's been observed that a shorter distance does predict a reduced sperm count and reduced fertility. So she designed a study called the Study for Future Families. And in this study, they took a group of pregnant women and they had urine samples to check the level of phthalates that were in their urine. And then the pregnancies continued, the children were born. And when they were about 1 year old, they brought the children in for an exam to measure these distances and look for an effect. And then this slide shows that they did find an effect, and actually a very strong one, that as you get to a more darker red towards the right, this is a type of phthalate. So this is the most common and what seems to be the most relevant to developmental health. That as you get into a higher level here in the 75th percentile, that you have a 13 higher likelihood of having this shorter anogenital distance. They also then wanted to look at, we see that this affects the anatomy, but does this have any effect on behavior of these infants? And so they administered a questionnaire that's been validated gives a masculine score for play behavior and different behaviors. And they showed that for the women here who also had the higher level exposure, they also noted that when they were 4 to 7 years old, when these children were in young childhood, that the women with the highest exposure here had the highest likelihood of having a lower than average masculine score. And so I think, this gets at that, a woman is exposed to phthalates maybe from cosmetics or from vinyl products during pregnancy, and they pass to the fetus by the placenta. But in addition to by interfering with the testosterone, this causes very physical differences in genital development, but this also may affect the entire infant. So we know that testosterone affects the brain and development of different behaviors between the sexes, and that there seems to be some emerging evidence that it affects different changes in play behavior and preferences. Okay, so now I'd like to talk a little bit about bisphenol A, which is really the kind of partner of phthalates. So phthalates is found in soft plastics, and it's what makes plastics very flexible. And then bisphenol A is found in plastics as well, and it's what's used to make plastics very hard and rigid. And this is what my personal research is in. So what is bisphenol A, or as we abbreviate it, BPA? So this is its chemical name. It's produced in even higher quantities than phthalates per year. And it's what makes polycarbonate plastic and also makes epoxy resins. And in a study by the CDC, this was from 2003 to 2004, they looked at people greater than 6 years of age, and they found this present in 93% of urine samples. So the chances are all of us are exposed to it, and we're really exposed to it every day. And this is also an endocrine disruptor, as I said. So some of the things that you can find BPA in, it's in the lining of canned foods, and it can be in a lot of canned food lining, but some of the highest concentrations are in acidic foods like tomatoes that could otherwise leach into the metal. This is used as a lining between the metal and the food. It had been used in dental sealants. Actually, receipt paper contains BPA. The lining of soda cans. Plastic number 7, which is commonly used for water bottles, contains BPA. Nalgene, some of the older bottles contain BPA, and they've since changed that. And then many baby bottles. I think some of the baby bottles and water bottles are some of the most concerning because this leaches into the water or into the formula or the milk. And particularly for babies, because their body weight is less, they're actually getting a much higher exposure. It can actually sometimes, even despite our best efforts, it can still be in tap water if water sources get contaminated. And then it can be in a lot of food containers, so hard like food processor containers or food storage containers can contain it. And there are many effects that BPA can have on reproductive health. I'll focus on infertility, but just to go over many of the different things that it can cause. There are suggestions that it can be linked to obesity and type 2 diabetes. There's some suggestion it could be linked to prostate and breast cancer. It mimics estrogen in the body, and so this is the theory for how it can be linked to breast cancer. I'll talk a lot more about miscarriage and infertility. Suggestion it could cause early sexual maturation. And this is definitely relevant to children, that this has been shown to pass the placenta and can be detectable in fetal cord blood, and may be linked to behavioral problems, and then potentially polycystic ovarian syndrome, which is a very common endocrine disorder. So there's been a lot of the research previously had been in rodents, and there's been evidence that BPA in very low doses can cause recurrent miscarriage in mice, and that over time the fertility of mice actually can affect future generations, that mice who as a fetus were exposed to BPA through their mother, then in future generations that they have decreased fertility. And so now I'll talk about the research study that I've been involved with during my time at Stanford. And so this is to look at the association between BPA and miscarriage. And this looked about 117 women between 2005 and 2009. And we had stored blood samples from all these women very early in pregnancy. They all had confirmed pregnancies. And then we had information of what the pregnancy outcome was, of whether they had a miscarriage or whether they had a live birth. And then we looked at those blood samples and we measured the BPA level early in pregnancy to see if we could find a link between a higher level of BPA earlier in pregnancy and miscarriage. We just received our results back showing that there does actually appear to be a link that when we look at the average level of BPA in the miscarriage groups, euploid versus aneuploid, which refers to whether it's chromosomally normal or chromosomally abnormal, we did see that there's a higher level of bisphenol A in the group of in the miscarriage group, and we particularly observed that we saw that in the euploid miscarriage group it was actually even the highest. I'd like to just spend a little bit of time to talk about some other environmental toxins because there are really so many. I'll just touch on a few of these. So PCBs, this is polychlorinated bipheноls. This was banned in 1979, but unfortunately, this still persists in the environment. It's very difficult to break down. It was used in a lot of electrical things like transformers and coolants, paints, and then unfortunately, through these hazardous waste sites, it's gotten into the water supply. Through that, it accumulates in fish, and that's how we get our major exposure. So outside of reproductive health, just important to mention that there have been some studies that have linked this to liver cancer and to malignant melanoma. So workers who've had very high levels of exposure to PCBs have been shown to find these diseases. So the main source for us of PCBs and to pregnant women is through fish. So salmon can have very high levels of PCBs, but this is specifically farmed salmon. So wild salmon from the Pacific coast or from Alaska is very low in PCBs, but on farmed Atlantic salmon that are farmed in very close quarters that can be in water that's contaminated with PCB can have very high levels. And although sushi can be, salmon sashimi can be from either farmed or wild salmon, often it is actually from farmed salmon, so it can be helpful to actually check what you're eating, and if you have the choice to pick wild salmon over farmed. So some of the potential impacts that this can have on reproductive health, PCBs actually are linked to a lot of things. They're also an endocrine disruptor. They affect the brain development in a child. They can cause birth defects in male infants. There's some evidence that it may, in males, cause more feminization or demasculinization of males. There's one study that suggests that it might affect sexual orientation later in life. It's been linked to reduced fertility and decreased sperm counts. Just briefly talk about lead. Lead's not an endocrine disruptor, but as a heavy metal, still in a lot of old paint sources, it can be found in dust and soil, and batteries and industrial plants. And actually, absorption of lead can be increased during pregnancy, so this is an issue for pregnant women. And for women, the main issue that in reproductive health that it causes is increased miscarriage, premature birth, and stillbirth, as well as cognitive effects on the developing fetus, the fetus's brain, and then in men can cause infertility. So I'm just going to skip ahead a little bit just so we have 5 minutes left. I'll speak briefly here about, if you haven't seen this yet, this is put out by the Monterey Bay Aquarium and Seafood Watch. If you're curious about which fish to avoid, fish contain mercury and PCBs are the major exposure in fish. You can go to their website, you can download this. They have it for each region, and it's the little red asterisk, which is by fish which you should limit your consumption due to contaminants. And so the bigger the fish, the more likely your exposure. So sharks, swordfish, tuna, those are the most likely to have exposure, as well as farmed salmon. Okay, so I'll just skip ahead a little bit to how environmental toxins affect male fertility. And so it's been noticed that in 1992, there was data showing that in the past 50 years, there had been a 50% decline in sperm count, and that this was observed in the United States and in Europe, but not in non-Western countries. And I think that the biggest explanation for why this is because of our increased exposure to environmental toxins. And then these are just, there are many toxins that have been linked to decreased sperm counts. Pretty much everything that I've talked about today that can cause effects in women can cause decreased sperm counts in men. So I know that it can be difficult to hear that every day we're exposed to all these chemicals, and sometimes even despite our best efforts, it can be hard to eliminate the exposure completely. So I just wanted to spend a couple minutes talking about what we can do actually to reduce our exposure. So first, in general, I think education is the major way we can make a difference. And this affects everybody, but I think it affects mostly pregnant women or women who are planning to conceive, women with young infants who are breastfeeding. And I think that those are the people who are most vulnerable to this. And so if you, can educate those around you, we can also make educated choices when we're purchasing products. And although there's a lot of products that have BPA and phthalates in them, there are also a lot of emerging products now that are marketing that they're BPA and phthalate free, so that sometimes you can avoid them. Hopefully in the future, there may be legislation to ban some of these chemicals. Canada, Denmark, France, and Germany have actually already banned Bisphenol A in baby products, but that hasn't been done in the US. As we talked, wild salmon is better. And then I didn't talk about pesticides, but that is one, that is also an environmental toxin that you can reduce your exposure by choosing organic produce. And then in general, just minimizing household dust. A lot of things actually can, a lot of these toxins are present in dust, and we can inhale them, or we can get them on our hands and ingest them while we're eating. So just general good hygiene and then reducing household dust can improve. And then specifically for BPA, so some of the things that you can do to reduce your exposure, you can use glass bottles are always safer from a chemical standpoint than plastics. So this is true for phthalates and for BPA. Although not all plastic number 7 contains BPA, pretty much BPA is, you can find BPA in plastic number 7. And so if you avoid plastic number 7 as much as possible, you can reduce your exposure. Also, not freezing or microwaving food in containers that are plastic and contain BPA, because that increases the rate that they leach out into the food. Getting rid of old, scratched containers that contain BPA, and then in the store looking for BPA-free products. Okay, these are just, this is an example of a few products that are out there that are BPA-free. So there's BPA-free water bottles, baby bottles now, and canned foods. Just running out of time, phthalate exposure, similar things, looking for phthalate-free products, glass bottles, avoiding vinyl and PVC, and limiting use of plastic food wrap. And then just to end on this is that these are just some resources which I thought were helpful, that has some more resources you can use. The Seafood Watch, you can download the seafood guides there. And then this website here, the Skin Deep Cosmetics database, you can look up any product and it will tell you what the ingredients are and whether it contains phthalates. And so for any kind of makeups or lotions, shampoos, you can put your product in there and see whether it's BPA and phthalate free. Okay, and then just thank everyone for coming, and then acknowledge the Women's Health Scholarly Application at the School of Medicine, with Dr. Jacobson, Dr. Stefanik, Dr. Westphal, and Jim Batterson. My research on BPA was supported by the Medical Scholars Research Fellowship. And then my mentor, Dr. Baker, who's my mentor for the BPA project. Shanna Swan, who in addition to some of her slides regarding phthalates was also a collaborator on our BPA project. And then also one of the other collaborators, Frederick von Saal from Missouri, also an acknowledgement that he ran all of our samples for us. So, all right, thank you.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.